Hi, my name is Michael Norbury, and this is me with my mom when I was 2 years old. And this is me with my mom today. Starting when I was age 5, my mom came down with a very severe case of breast cancer. For the next 18 years, our family went through one relapse after the next, up until 2003. I'm happy to report that now she can still drive a car despite only having one arm, and she really enjoys yoga. And we thought after 6 years, up now in 2009, that the threat had finally passed. That is until this current healthcare bill was proposed. There's a lot to be concerned about with this legislation, from the fact that it gives de facto coverage to illegal aliens by not specifically banning it, or the fact that it's cutting back on special needs assistance, which has got to be a real bummer to all those out there with autism awareness stickers on their cars. But the thing that's really got my family concerned is the fact that they're shifting to a cost-effective, outcome-based model, which is something that's really going to be a threat. A big reason of why my mom's still here is because of an experimental treatment that'll likely be wiped out under this bill. I know this is a heated subject, and even the president has lost his mother to cancer. I just don't think I should have to lose mine too because of this legislation. It's unfortunate the president blames his loss on insurance companies, because when it comes down to it, forms and payments are just the tip of the iceberg when dealing with a life-threatening illness. I know insurance is expensive, even when you factor out the fact that they pay 30 to 40% of their costs go to cover Medicare and Medicaid payments in addition to their own private customers. But see, care is the most important thing. It makes a big difference when something as common as breast cancer warps into something you haven't even heard of before, like a condition called lymphedema. This healthcare plan guarantees coverage to all, but not necessarily adequate care. It's like somebody promising to pay you $50 an hour, but every time you get your paycheck, it's still set at minimum wage. There's a much better, simpler answer to this whole thing, and that is to model our health insurance industry off of the successful car insurance model. All you have to do is break up the state monopolies, and boom, competition will do the rest. Doing this will lower costs, improve care, and best of all, create a whole lot of jobs. And it doesn't take $1 trillion, $1 billion, or even $1 million in taxpayer dollars. Private competition takes care of all of it. Now I understand, or we've all seen, that the politicians really aren't paying attention to ideas like this. But there is a solution to this called Bring Home the Politicians. The plan is to relocate U.S. representatives and senators to our state capitals and state representatives and senators to our city halls and courthouses in our districts to securely telecommute for no less than 75% of their terms while we surround them. This idea is as simple as it is powerful. Angry about the way things are? Bring home the politicians. Lose your job? Bring home the politicians. In debt, homeless, in prison? Bring home the politicians. This idea is also surprisingly doable because Article 1, Section 4 of the U.S. Constitution requires U.S. Congress to meet only once per year in D.C. The Democrats actually proved this idea works with their healthcare war rooms they set up during the August 09 recess, which allowed the administration to stay in constant contact with its party's representatives and senators while they're at home in their districts, using phones, faxes, emails, and web conferences. Going from a centralized constitutional republic to a localized constitutional republic isn't going to happen all of a sudden. It's going to start in the states. Every state constitution contains a seat of government section that Bring Home the Politician applies to. Colorado, for example, clearly lays out the process for relocating Congress. Step 1 starts with simply spreading the word about Bring Home the Politicians, turning apathetic citizens into active voters. From there, we contact all the candidates for the 2010 election on both the state and U.S. level to tell them to add this idea to their platform. And finally, 18 states actually have the ability to add this idea to a ballot initiative, which they can pass in their state without even having to rely on congressional approval. Still on the fence? Just think of all the benefits. It restores the balance of power with citizens put back in charge of this country. It's nonpartisan since this plan favors no political party since all need to be reined in. It's anti-lobbying with lobbyists forced to spend most of their budget on expenses. It reduces corruption with citizens and local media resuming their role as government watchdogs. It's cost-effective since the price of upgrading state and local facilities for this plan is dwarfed by the savings for stopping out-of-control government spending. And let's not forget the national security benefits, because with this in place, any natural disaster or assault on DC will be far less catastrophic because it would be taking down only one server on a grid of 51. This is a great idea, so unless you're a big union in desperate need of legislation to keep you from going bankrupt from political overspending, or a major corporation that stands to make billions off a cap and trade, there's no reason to oppose this idea. Health insurance modeled after car insurance is the answer, and Bring Home the Politicians can make ideas like this a reality. This is what me and my family are fighting for, and it's what you need to be fighting for. We've got a golden opportunity here to do something the world's never seen before. Come on, join the movement at BringHomeThePoliticians.com. It's our future, and now's the time to make it happen.